Hi, I'm Heidi Muenchberger and I'm an Associate Professor of Healthy Design at the Centre for Community Science in the Griffith Health Institute. I became interested in research while I was working as a neuropsychologist in New South Wales, and an opportunity came up to do my PhD with Professor Elizabeth Kendall, which an opportunity I took. And 10 years later, I'm still doing research with Professor Kendall and a big team that we have at Logan. My research interests are in healthy design, so the design of the built, social and health environment. And that means people who have chronic and catastrophic injury, how do they live in the world in the best way possible? And the research that we've done more recently has shown, how do we build buildings to make it accessible, to make it an optimal environment for someone who can't otherwise get around? How do we provide support services for people who really need to be understood better? What do they want? How do we listen to them? And what can we provide in that instance? So it's quite broad, but also at the same time gives us quite a good focus. One of the more recent projects we've worked on that gives us a sense of impact and outcome is a model of care project, and that's with one of our major industry partners, Young Care Australia, a non-government organisation, not-for-profit, working to improve the lives of young people with chronic illness and catastrophic injury. What we've done in that is, with my team, Michelle Harris and we've designed a model that says what works, but also what do people want. So we've actually looked at a whole breadth of interventions that will tell us how do we listen better to people, how do staff work with people with major injury, and how do we identify the health goals of people who would otherwise be ignored in the health system. So these are vulnerable people that we like to work with, and we find that there is small change that can be made on a daily basis, and that's what we try to do. One of the projects that we've worked on recently was around the design of healthy environments, so an actual building for people with catastrophic injury and illness to live in whilst they have their care and support needs provided. The project actually resulted in a set of design guidelines, so for architects to understand how to best respond to the needs of younger people. So where to put the walls, how to design the kitchen, how to think about the bathroom placement and the natural environment around that. And these are things we've often taken for granted, or certainly not really considered as being something that's optimal to the environment. Rather, it's been just what we've had to do, but we think we can do a better job than that. One of the key issues for the future of research in my area is design for all, and that's about design for not only for people with disabilities but people in mainstream. So what we want to try and do is say, well, the environments that we live in should be accessible to everybody, and part of that is about where we live, so our housing environments. Part of it is how we receive support and healthcare, and not marginalise people on the basis of disability.